of people's social networks. Research shows that their approach keeps people out of prison, reduces drug use, and improves the overall well-being of families living in poverty. The American Probation and Parole Association is an international association composed of members from the United States, Canada, and other countries actively involved with probation, parole, and community-based corrections in both the adult and juvenile sectors. All levels of government, including local, state, provincial, legislative, executive, judicial, and federal agencies, are counted among its constituents. By taking the initiative, APPA has grown to become the voice for thousands of probation and parole practitioners, including line staff, supervisors, and administrators. Educators, volunteers, and concerned citizens with an interest in criminal and juvenile justice are also among APPA's members. The association represents a strong, unified voice for the field of community corrections, whose mission is to serve, challenge, and empower its members and constituents by educating, communicating and training, advocating and influencing, acting as a resource and conduit for information, ideas, and support, developing standards and models, and collaborating with other disciplines. Today's audio teleconference and webcast will give community supervision officers an overview of the core components of the family support approach for community corrections and tips for how to incorporate the approach into supervision practices. Specifically, this broadcast will help supervision officers identify why families and social networks are important to community corrections practice and provide an introduction to some tools and techniques that can be used to help individuals under supervision identify their families and social networks of support and leverage the support of these individuals to meet their supervision goals. By the end of the presentation, we hope that you'll be able to determine some ways that you can begin to incorporate more family-focused, strength-based approaches into the work you do with individuals you supervise. Before we go any further, I want to take care of a few details you may find helpful as you participate today. In pre-event emails, you were instructed on how to access the participant handouts for today's broadcast. The handouts include a copy of today's slides and a post-session evaluation form. If you were not able to access the materials before the broadcast, they will remain at the link we sent you. If you have trouble downloading the files, you can email me at pmullins@csg.org, and I will be glad to email them to you after the broadcast. We've had an overwhelming response to this audio teleconference and webcast. We registered more than 50 telephone lines for today's broadcast and recognize that many of the agencies that registered for lines have multiple persons watching and listening in via speakerphone. To prevent problems with distracting background noise due to the number of persons participating today, we have muted all participant lines. As with all of APPA's audio teleconferences, today's broadcast is being recorded and will be posted on the Apple website within the next 2 weeks so that you and others can go back and review the material. I want to remind you that this audio teleconference and webcast is designed to be interactive. In that respect, our trainers encourage you to ask questions. To ask a question, you should click on the chat link located on the left side of your screen. It has an icon next to it that looks like a cartoon balloon used for when cartoon characters talk. Once you click on that link, type in your question and then instruct it to send to the moderator. At various predetermined points in the presentation, the presenters will address questions that are being asked, and they will answer questions as time permits. Your trainers today are Christine Toner and Tina Santiago. Christine is the Clinical Director at Family Justice. She provides clinical guidance and expertise throughout the agency and for successful startup and operation of new bodega model projects around the country. She works closely with staff and partners to address quality improvement and model development aspects of the program. Prior to this position, Christine was the Senior Training Associate at Family Justice. As lead trainer and curriculum specialist, Christine developed and facilitated trainings nationally based on Family Justice bodega model. Prior to working for Family Justice, she worked for the New York City Department of Probation. Tina Santiago is the program manager of La Bodega de la Familia, which is the direct service center located in the Lower East Side of Manhattan. She's been with Family Justice for 10 years. Prior to her current position, she served as a senior family case manager for 8 years. This gave her hands-on training experience of the bodega model as well as on the parole and probation partnering. So without further delay, I'd like to turn the presentation over to Christine and Tina. Christine, I believe that you're planning to speak first.
Yes, thank you, Tracy. I wanted to start by talking a little bit about this exciting project that Family Justice and APPA worked on together with the funding from BJA. Basically, we've taken the lessons learned here at our direct service sites where we have been working with probation and parole around introducing a family-focused approach, and we worked with APPA to develop a curriculum for supervision officers, predominantly people who work with on the adult side on both probation and parole, to see what could be integrated into regular case practice. It's been a really exciting project where we've been able to pilot the curriculum in 4 different sites around the country and get lots of different feedback from officers in the training to see about how they could best see these practices as enhancing supervisory practice, not as something extra or completely different. And I think the exciting piece, too, for our work here has been predominantly with the adult population, the idea being that families and social connections are really intrinsic to understanding supervision practice. Oftentimes we hear from people in the field that they have an understanding that families and social networks and so forth are important, but it's the how do we get to it, especially when we're talking about officers having anywhere, from 80 to 150 or so individuals that they're supervising. How do you begin to look at these complicated issue of social networks? So to begin today, I'd really like to know who's with us, and we have our first polling question, and basically I'm looking to see what type of agency do you represent, and there's a whole bunch of different responses for you to check, and if you could check any that apply and hit answer, that would be great, just so that we can get an idea of who has called in today. Do we have any responses, Tracy?
Yeah, we have they're going up rapidly. There's about almost 80% that have responded so far. I'll wait a couple more seconds before publishing your results.
Good.
Okay, I think that's all that's going to answer.
Great. So I see that we have a large group of people from adult probation and adult parole, and that's great because that's exactly who we targeted in piloting our curriculum was adult probation and parole officers, and we were and oftentimes we get questions about, well, which individuals should be targeted. And again, what we're going to be talking about today is how to enhance general supervision practice, that it is not a program or that there are specific individuals that would be best for this approach. Because as we talk about it, we all have connections and we are all connected to others. And so it's really talking about how do we capitalize on those connections. And so to begin with, the idea of family and what do we think about when we think about families. And I think that it is a really important piece because here at La Bodega de la Familia and the work that we've been doing at Family Justice is we talk about family as broadly defined. And I have here another question just to sort of get people thinking about how do we usually think about families. And I just have up here families are. And if people will take a moment to sort of respond to that as to sort of what your initial reaction is when you hear the word family or you think about families, what do we usually think that means?
People are responding.
Good. Woohoo!
Okay. Responses are starting to wane, so I'll close it for you. There you go.
Okay, so very clearly we have defined by the individual. And I think that is so important. And I think that generally that is the response that we get. But what oftentimes happens when we're actually doing the work, we start to narrow sometimes our perspective on families and we start to think about we go back to blood relations, or we go back to people that people may be living with at the time, and so forth. And I think oftentimes if we think about who are our go-to people and who are the people who are most important to us, sometimes they are not actually blood relations or people who we might even be living with at the moment. It might be a cousin or somebody who lives far away who we remain in sporadic contact with. And how do we get in touch with those individuals? Because those are the people who oftentimes can start to talk to individuals about what's going on, and those are the voices in their head, I'd like to say sometimes, the people that they're most listening to about, thinking about doing things differently and so forth. So, next I want to go into this idea of why families. So why do we even talk about families at all? And I think that we have a good understanding at this point, and the research continually shows us that individuals that have strong social connections and social networks tend to do best in the community. Those are the individuals who have usually meet sort of supervision mandates and so forth. And this is pretty much the premise of how La Bodega began, the idea that if we introduce sort of this family-focused approach, would it change outcomes? Not necessarily adding more treatment or adding more services, but the idea of just sort of changing the scope of how we understand the situation. Would that change the situation? And I think that we need to understand that when people are coming under community supervision, it is truly a pivotal time for families. And the next slide certainly looks at this idea that with support, people under community supervision can assist their loved ones. Oftentimes, we discount the connections and the family networks that people have as being uncooperative, or sometimes we label families as being dysfunctional or not being able to help without truly finding out if that's true. I think there's also we need to understand that the beginning of probation or parole can be a sort of crisis for families, and so that families' dynamics might be changing. They might not necessarily be presenting in sort of the best possible light at that moment. So I think understanding all that and recognizing on some level that people are sort of showing different sides of their of themselves at any given time. I think also, along with thinking through why this is a pivotal time, is that, again, about the strengths piece, that a family-focused approach certainly taps the strengths and natural resources of families. And so what do we mean by that? Well, we mean that, generally speaking, families are going to know more about what is going on within their communities than oftentimes supervision officers will. They themselves may know of a program, let's say, or may be able to talk to somebody within the community about a job opening or other kinds of opportunities for individuals that we ourselves would be unable to access. And I think oftentimes families are anxious and want their loved ones to succeed under supervision, but don't know what to do to sort of assure or to sort of help that happen. So in terms of engaging families, this is also a way of demonstrating to them what they can do to sort of assist in improving outcomes. We know that, and the next slide speaks about how families help improve outcomes. They certainly support are there day and night. I mean, they are a constant presence. We know that, that is not something that, we're able to do. They also have the long-term investment. The fact of the matter is that supervision officers should be a short-term position in somebody's life, and at some point that is going to end, and that the long-term investment certainly outlasts that. Also, I think oftentimes when we've been doing these trainings, and in my experience in working in New York City probation, this early warning system, oftentimes officers talk about the experience of mothers, brothers or, other, concerned individuals calling the officer to say, I know he's been out all night, she hasn't come home, these concerns and these ideas of do something. And so the fact is that instead of sort of waiting for sort of some of these crises to occur, is there a way to certainly engage those social networks from the beginning so that they certainly have an understanding of what they could do to certainly help and how they have a lot of the abilities to sort of, help those situations. And then, also the last thing that I certainly have up here on the slide is around sort of cultural understanding and so forth. The idea that oftentimes we don't completely understand certainly the entire cultural context in which individuals live, and certainly most of us have learned about our cultural context from our families. So certainly having some understanding about that or getting some information about that could be very helpful. Our next slide begins to look at why, what some of the issues that come about around this sort of shifting to a family support approach. Because, the more I've sort of talked about this, I've realized that for many people it seems very intuitive that, well, yes, it seems to make sense that you would want to capitalize on these kinds of connections and supports that people have. But when you start to recognize how much our system and how much we sort of are very focused on an individual approach, you realize that, the shift, that there's a lot of, different ways that the shift can start to take hold. I think that, the one thing about the family-focused approach is that it certainly does begin to look for opportunities and prevention and starts to really, broaden the lens. Whereas most of our individual practice and so forth is focused on preventing recidivism and relapse and really staying very focused on that one individual in front of us instead of seeing sort of the broader picture of what is happening. Also, I think that our individual approaches, really rely very heavily on, which is important, but risks and need and assessment tools, which I think only tells us part of the picture of what's going on. What definitely happens when we're able to sort of talk more about a family-focused approach is that it certainly begins to talk about those social connections that people have, and we begin to gather information on some of those supports. And if those supports have somehow waned or the individual feels are not quite as strong, then that would be an important piece to be addressed because, again, this goes back to what I, at the beginning about how research has told us how important having those connections are for somebody to be successful under supervision. You can move on to the next slide, Tracy. You can move on to the next one as well, Tracy. Thank you. So the family support approach, so what is it? So I've spoken a little bit about sort of what happens when you begin to look sort of broader and some of the things that might happen, but what does it really mean to take on this kind of approach, and what have we distilled from our learnings here? One of the things that we've sort of come down to is sort of these 4 general areas that we like to think about in terms of the approach. One is that we consider people in context. And so, that sort of a simple sort of sentence, but we like to say that there's a lot behind it. The fact is that at any given time, we are only sort of presenting one side of ourselves, that we are all very multifaceted. And I think, in many ways when we think about it, it's obvious, depending on what the situation is, a different part of ourself is activated. The way in which you may interact in your office may not be the way in which you interact on a Saturday at home, that there's different parts of us at different times, and that besides that there's different parts of us, we all do come from a cultural context and in a community context, and how does that get played out, and how is that sometimes different than perhaps our context as a supervision officer, and how much do we allow for hearing about that context and at least trying to in some way understand that there might be a difference there. The second piece is building on family and community interactions, and again, many of these have been sort of boilerplated down, but the fact is that is also can be quite complicated. The fact that oftentimes, sometimes family interactions from our vantage point, may seem poor, may seem somewhat broken. But oftentimes when talking to individuals and asking them, who was the last person to tell you that when you got things together to give them a call, who was one of the last people that you went to for help, and so on and so forth. So this is a way for them to begin to realize that oftentimes the response was when you get your act together. So that there's still an ability there to sort of, build on those interactions. Also, oftentimes if we're working in communities that are not our own communities, we may not know as much about the strengths of that community or some of the more positive happenings. We really need to hear that from families and individuals about their community and so forth. Because, again, many times people are more apt to follow through and to be a part of things if it's place-based, if it's in their community, if it's accessible, and so on. The next one about recognizing the strengths of individuals, families, and communities, again, and this goes along with the last one, the strengths of probation and parole, the idea that this approach is very much grounded in a strengths-based approach. And I think that, it's obviously that could be a whole training in and of itself, just about strengths-based work. But the fact is that it is so important to keep in mind that this is very much about a balance of understanding that there is assets and strengths within every individual family community and within departments, as well as challenges. And so that it is never saying that we do not hold people accountable for their behavior, but it is saying that if you are looking for any sort of change or any sort of recognition of doing things differently, one must capitalize on people's strengths and abilities. And we're seeing that more and more in the research, that if we only sort of remain focused on the challenges, it is not providing an opportunity for the individual or the family to recognize the abilities and strengths they have to overcome or to work through those challenges. So, here, some pointers about how best to go about conducting strength-based community supervision. I think one of the, important pieces to begin with is this idea that you recognize and leverage the strengths and abilities of individuals under community supervision. And that's not always so easy, and I think we also have to recognize that the field has not completely gotten there, and it's not just our field under community supervision, but counseling and mental health professionals and medical, all come sort of out of this medical model. And so it is usually about, find the problem, fix the problem. And this is really about, yes, there might be some challenges, but what are some of the strengths that we can activate? And so that takes a little bit of work, really finding those and letting people know, and then also letting people know and families know that they have those strengths. The second piece around allowing individuals to maintain some control, and I think here the piece again is that it is not saying that individuals under supervision can sort of set the full agenda and sort of say what all their goals are and so forth, but it is about engaging them around a discussion about these are sort of your supervision mandates. This is what has been put forth. Where do you see yourself beginning at this point? What kinds of services have you tried in the past around these issues? What kinds of, organizations have you been to see if these needs can be met? So that there's certainly a way of engaging in that dialogue, and that sort of, engages the individual to recognize that they're part of this process, that they're not just, certainly being told where to go and what to do, but that they're actually encouraged to sort of talk about it, sort of explore what they think some of their options are, and really encouraging them to also talk to their social network about getting some of these goals met and so forth. And then considering the community as a resource, I think that goes back to, sort of what I had been saying earlier, the fact that sometimes we don't know everything about communities, and I think that's true of even the communities in which you live. I mean, I certainly know just from my own community, I'm always learning something new, and I'm like, wow, I didn't know that existed. We have that, So I think that it's always certainly keeping an ear open and allowing families to sort of step into that role of expert of knowing about their own communities. And the last, about case management being active, I mean, certainly here in our direct service sites, and Tina might speak more about that, the idea of home visits have always been very important. We have certainly always believed that to represent and to see the community as a resource, one must be in the community. And so that's the other piece, that I mean, if we're only asking people to report to an office and we're not actually in the community and meeting with people, and certainly that's a way, oftentimes I've heard officers say that they have met family members and other individuals because of being active and being in the community. You naturally seem to meet more people within the individual's life. Okay, we can move on to the next slide. I don't know, I feel like I've said a lot in a short amount of time. Are there any questions at this point that anyone might have or that have come in any way?
We have had one question, and before I read that, I'll just remind the participants that if you want to ask a question, just go and look on the left-hand side of your screen and click on the chat link that looks like it has a little cartoon balloon next to it, and send your question to the moderator. Right now we have a question from Patricia, and her question is confidentiality not an issue when talking with family members, for example, drug use treatment? My experience has always been to shut them down and say we are not at liberty to discuss the offender's probation.
Well, I think one of the things that we have always done here is that, one, we try not to sort of keep any secrets. We certainly, before meeting with another family member or somebody else who's around, we've certainly told that individual that this is something that we're going to talk about. Does your family know that you're going to drug treatment? Are they aware of this situation, and so forth? I mean, we have found that oftentimes, although the individual who may have been identified or has been sent to us, the individual under supervision, says that nobody knows and they don't know about their use or what's going on, they oftentimes do know. It just has not been brought out to the forefront for any sort of discussion. So we deal with the confidentiality issue by, one, saying to the individual under supervision, this is something that we really think that you need to be able to talk to and tap into your social network with, because nobody does it alone. And I think that that's the big message here. I think oftentimes we certainly have a cultural backdrop as well that sort of says, you can do it on your own. You don't really need anybody. And so I think the first piece is to say that nobody ever does it completely alone, and that even though they think that these individuals don't know that there's something going on, they generally do, even if they haven't put a label to it. So once we always start with the individual to get the okay from them, and then certainly move on to have a broader discussion with their social network.
Okay, and we have a question from Peter. What about families that are the problem? How is this acknowledged in the approach?
Well, I think one, we have to look at, who's defining the family as a problem. I think that's the first piece, and I think, it's hard to know in terms of that very, sort of general statement. So one, I think there's two things I'm thinking. One, who defines them as a problem? And because other family members might be dealing with, struggling with addiction and other kinds of concerns, doesn't mean that they could not possibly be a support or also be of some sort of assistance. Having said that, there are going to be situations where perhaps a family and the individual, and now if we're going back to the idea of family in terms of blood relations, it's about, is this individual or whoever you've put forth truly a social support to you? Are they really helping you achieve your goals? And reminding the individual what their goals are. And if this individual isn't somehow, not, certainly helping them along with that, then that's something for them to start to look at and re-look at and start to look for others that could support them. I think the message is that, again, nobody can do this on their own. So if there is some people in your social network who are not helping you achieve the goals that you want, then who else can we bring into your social network that could do that? I think that, this is about saying, oftentimes in supervision we talk about people, places, and things, right? And the idea is to stay away from them, but where am I supposed to be then? And people can't just stay away from people. People need sort of that connection. So it's about talking to them about the connections that they have, and then allowing them. I think it's about who is defining the connection as a problem, and that really needs to come from the individual, not so much from somebody else telling you that it's a problem.
Okay, we have had another question come in from Shanna. It says, is this approach for families who are interested in the subject's success, or are we going to talk about the subject whose family does not care about what happens to the person until they violate? And then she sent a follow-up saying, meaning families who don't want anything to do with agents until the person is in trouble. Did you get that?
Well, I think what's being asked is this only for people who come in with their families, wanting to help, or is this also about people whose families are right now to help? That's how I'm kind of hearing it.
Yeah, until they do something wrong, who are only interested in
right. And I think that that's a pretty sort of normative kind of response. I mean, I always like to say that if you had somebody under supervision who appeared in the office or when you went to their home for your first visit and so forth, and their social network was there and saying, we want to help, what can we do, then they probably don't need much of an intervention. The fact is that the majority of individuals under community supervision have certainly in many ways perhaps harmed family members, perhaps their social networks feel kind of tired of trying to help or to do things. So I think it's not uncommon that we don't hear from these individuals until something has gone awry, and that oftentimes they are hesitant to once again become engaged or try to, help in a different ways. I also think we have to understand the context in which we come from. Many families do not trust community supervision officers and have a great deal of difficulty seeing how talking to a community supervision officer is going to help. I think a part of that is also recognizing that we do have similar goals. Community supervision officers and sort of everyone's mission statement and so forth is, community security and keeping people within the community safe. And oftentimes that is the same thing that social connections and social networks want, right? They want their individual to stay within the community. So I think it's about how we engage in that dialogue with families that we perceive as being very resistant, but also understanding that what does that resistance mean? And generally it's coming from a place of distrust. And how do we sort of engage in that discussion in a different way.
And then we have a couple more, but let's take one, and then you might want, here, I got two more questions for you, okay?
Okay.
One from Liz that says, what do you feel is the most effective tool in changing the mindset of community corrections officers who believe that their role is to identify challenges rather than emphasize positives of those on supervision?
What do I believe the biggest challenge is to switching?
What do you feel is the most effective tool in changing the mindset?
Okay. And you know what? I don't know that you have to change the mindset. I think the idea is that, okay, it is very important to identify the challenges. I completely agree with that. But then think about it. What does that person need to overcome those challenges? And generally, if we talk about sort of self-efficacy and people's strengths, what stops many individuals from being able to achieve their goals is that they don't feel they can actually do it. They don't have a feeling of self-efficacy. And so we need to figure out how we can have people start to feel like they can actually go to drug treatment. They can actually hold a job. And so how do we begin to help people recognize that they have some of those strengths and abilities? And Tina, who's going to speak next, will talk about how, some different kinds of questions and things of that nature to really try to get people. So I think that it's a two-part process. It's not about not identifying the challenges, but it's like, okay, I've identified all these challenges. How does this person go forth and start to, overcome those challenges? And it's, and again, I always like to think like, well, how do each one of us start to overcome challenges? And some of it is self-efficacy, belief that we can overcome it, and sort of having some knowledge of our strengths and abilities. And many people, and this isn't just true of people under supervision, but just people in general have a great deal of difficulty sometimes identifying strengths and abilities.
And then we also have a question from Gordon, and then after this question we can move on. He asks, we have rules about clients living with other felons. When this is within the family, is this approach valid?
Yeah. Well, yeah. I mean, I think that the thing is that, again, think about anybody coming in and sort of saying that, I mean, I understand that departments certainly have regs about, certainly felons living together and so forth, but people aren't going to stop talking to their family members because they're a felon in and of itself. And so I think that, the point of this is that, again, it's about not us deciding those things, but saying to the individual who may be under your supervision, how does, maintaining these social networks help or hinder your achieving your goals? Right? So it's sort of like asking those sorts of questions. The fact is they may not be able to live with the felon, but that doesn't mean that they still won't keep in touch with them in some sort of way. So I think that, it's easier when we sort of, have these rules, and certainly I'm not suggesting that you don't sort of enforce those kinds of things, but the idea being that that isn't going to be something that's just going to stop a connection. So it's about reflecting back to the individual, sort of how do they see that connection in their life.
But I think also if two parolees or probationers living under the same household because it's a mother and son or daughter and father, then it's about supervisors allowing a probation officer or a parole officer to supervise both parties in a home, because how do we separate families when they are families? And they have a lot of connections irregardless because they're blood relatives. And that's when we speak about blood-related individuals.
Okay. Well, that's all the questions we have for now. Thank you for those who submitted questions. You can continue to submit questions as we go through the broadcast. There'll be a couple of other points where we'll address those. So if you have a question as we're going through, just go ahead and send it. Christine and Tina?
Great. Tina's going to talk a little bit now about the tools of the approach, which I think is our next slide.
Here it comes.
Here we go. So Tina Santiago, as Tracy mentioned at the beginning, is our program manager here at La Bodega de la Familia, which is our first direct service site. And she's going to walk you through what we like to talk about, our 3 tools to the approach, and she'll talk to you a little bit about what we do here. Tina?
Hi. We use three tools. We use a Genogram. The Genogram charts a family history to identify family strengths, their resources, and the strengths that have hindered families and the challenges that they have faced. And our approach to our Genograms are to look at a 3-generation of family and kind of pinpoint the positive outcomes that family have been able to achieve. Although, if you were to see the genograms are a diagram that kind of identifies the history. It identifies strengths. It identifies resources. It also identifies some of their deficits as much as the strengths that come from those deficits. The eco-maps are diagrams that depict on social networks, community involvement, government involvement, other families, broadly defined, friends, schools, medical places of worship. And our supportive inquiry relates to how do we ask certain questions so that we can acquire the information that we're looking for, so that we can guide families to empowerment, to be self-reliant, to become independent. It's a way of asking and listening to these insights that play a role in activating assets and focusing on solutions to their challenges. And if we look at the next slide, we can see how the genogram, as I said, that looks at 3 generations of families. It starts with grandparents, starts with the identified member, which is, as you can see, Ruth, who's involved in the criminal justice system. And if you look at the diagram, it kind of shows you that their involvement in criminal justice system, it shows you the substance abuse challenges. It also indicates how this person was a high school graduate. It shows the relationship and that this person has with their significant other as far as domestic family violence, domestic violence. But it also indicates how the husband is a high school graduate as well, and has no further involvement with anything else. And it depicts the children, the ages of the children. It also shows families who have passed on due to, it also indicates their challenges as well as their successes. Genograms are a family tree that kind of helps us understand a family. It helps us guide families in a way that when they see this picture being depicted, because it's being done with the families, it's something for them to kind of look back and say, wow, I've never really seen my family in this way. All families say the same thing because no one sits down and kind of just draws a tree in regards to their family and their background. So it's a helpful tool. It's very interesting to gather all this information because it also sparks a way of conversation. It sparks a way of looking at what is it that they would like to accomplish, because it's not about me setting up goals for them, but it's about them setting up their own goals among and around their family and what they need. And especially when there's children involved, what's the best things that they're looking for their children. We are also, how can we help and what would they like us to help them with? It's not about us finding that solution for them. It's about them finding a solution for themselves. So independence and self-efficacy, what Christine had spoke about earlier, is all combined in one. And this is how we use these genograms to kind of help us understand families, help us see what can we guide them in a different way, and how we can use other family members to help assist in the challenges that are happening with maybe the cousin or the niece or the nephew. It's always it's a great way to kind of find and utilize this tool so that it can help me determine what would be the best ways that I can come up with guidance, questions, and answers that can help them in a better way. We can move on to the next slide. Eco-maps. Eco-maps are also done with the family. It shows, it depicts mainly what they're involved with in their community. What are they affiliated with? Whom they're affiliated with? Where children are in school at? Where are they going for medical services? What other services they're involved with? And sometimes if you look at this, and there's a lot of things happening in the family, it's also used to kind of in a way to cut down on what is needed in that family. Maybe we can help them find 3 things in one location rather than having 3 things in 3 different locations. It helps us minimize the challenges that they are going to face on a daily basis. You know, it minimizes the fact that, oh my God, I have to go to my doctor and it's all the way in 155th Street rather than it's here around the corner. So we're just looking at ways to help families see that there are strengths, that there are positive strengths, there are strong strengths, and there are neutral relations. There can also be challenging relations. As you can see, the family has a challenging relationship with public housing because of the felony that a family member may be involved with. So definitely that becomes challenging for the person that lives in public housing, because if you've been committed of a felon, you can't live in public housing. But it's going to happen anyway, and our job is to kind of help them maintain their homes as well. Next slide is our supportive inquiry. How do we ask our questions so that we can guide families in a way that is a positive way? In order to get from them what are they looking for, what do they need, we kind of ask them questions as far as whom were their support network, who was there for them while they were incarcerated, who wrote to them, whom actually send them packages. They always have someone that has assisted them while they were away. In coming back into the community, we tend to look into who took care of their children while they were out, who asks them for help, as well as who they ask for help for themselves. If things change in their life, who would be the first person they would notice this is happening in their lives? Depending on how we ask these questions, we're going to get the answers that are going to help them identify their strengths and their support networks. Asking solution-focused questions as well, exception, scaling, miracle, survival, is, for instance, an example, families that have struggled with addiction and keeping a home has been, it's a survival mechanism for them, because if they can keep a home, although they've had all these other challenges, that is a strength. A person that can keep a job, although they have had substance abuse issues, that is a strength. And I believe that if there are any other questions, we can go to the next slide.
Okay, we did have a couple questions come through, and I encourage anybody else, if you have questions on the tools and techniques that were just discussed, to please send those by clicking on the chat button and sending your question to the moderator. We have a question from Lisa. Her question is, eco-maps and genograms tend to be tools used by social workers. How do you get buy-in from those who do not have that background, and how do you sell the usefulness in view of the many tasks that POs already need to complete?
Well, starting with, we are the direct service site. They're family case managers. They're not social workers. It's a way of utilizing these tools to kind of depict what we do. It's training, and it's a helpful mechanism because it's, motivational interviewing. How do we interview? You don't need to be a social worker to utilize motivational interviewing. You can definitely use that as something that you've acquired because of what you've learned. And that's basically what we do here. What was the other question? I know that.
She's basically asking, how do you get probation officers to see the usefulness of using these tools?
Also, I think one of the things is that, especially the EcoMap, I think people start to see the usefulness when they actually test them out. And I think that, certainly in training and so forth, we've seen where officers have come around. And certainly I think that, sort of our experiences here where we partner with probation and parole, that the officers themselves start to use the tools on their own, regardless of whether or not there's a case manager with them, because they see that it changes the discussion and that these tools being visual in nature certainly helps the individual under supervision and their family understand their context in a different way than if they were just interviewed.
And then Gary had a question. Are Genograms generated by a software program, or do you do them by hand?
We do it by hand. We actually do it by hand. And with the families, in front of the families can also add to it. We try to tell them, oh, come on, you can do this. And as long as we kind of identify that women are on the right side, women are always in the left side, men are always in the right side, and how to break it down. And that's the way we do it with the families, so that they see that this is something that they're part of. This is their picture. This is the family picture.
And then we've got a question from Daleen that asks, what do the terms on slide 15 mean? Which would be, I'm assuming,
about the asking solution-focused questions?
Yeah, I think that's probably the difference between the exception, scaling, miracle, and
right. Well, those are different kinds of questions that we have found have been very successful. I think the other piece around working from a family-focused approach is the idea that we want individuals, and if they can't do it, then also their social support network to generate sort of solutions to what is going on, right? To really own the situation so that it is not something that is just sort of handed down. So these questions, and starting with the exception question, are questions that really start to change that discussion. So the exception question is about, has there ever been a time when whatever the desired behavior you're looking for was not present? So can you remember a time when you were not drinking? Or let's talk about that week that you were sober before the relapse, right? So the exception is looking for moments when the behavior was not there, because at the end of the day, isn't that what we're looking to replicate? We're looking to replicate moments, not so much the relapse. So it's really about looking for those exceptions and then finding out what was happening during that time that allowed you to keep that job. Why were you able to keep that job and has been unable to keep one since? And the scaling question is a good question that people like, because oftentimes when we talk to individuals and their families, right, we ask them, this is what's happening, this is what we need to do, you really need to get yourself into drug treatment. They go, yeah, and they'll just nod. Basically, they're just trying to get out of the office or get you out of their home as quickly as possible. And you're saying something like, this is really important. They go, yeah, it's really important. And so something gets lost in the language. So a scaling question is about saying, okay, look, on a scale of 1 to 10, how important is it to you and to your family and so forth to go into a drug treatment program? Because numbers really help me understand. And I always get this confused, but as long as you keep it the same way, let's say 10 being this is the most important thing for you to do, and 1 being this is not at all important. So if they're telling you, they're like, well, it's about a 3, and you're sitting there as an officer thinking this is a 10, that is kind of telling you where you're at, where the gap is. Also, the scaling question can be asked around self-efficacy issues that we had mentioned earlier. So on a scale of 1 to 10, so after they tell you, let's say next day instead of 3, they told you it was a 7 to go to drug treatment. So then your follow-up could be something like, okay, and on a scale of 1 to 10, where do you place yourself on being able to successfully complete a drug treatment program? And that is very telling as well, because sometimes people will give themselves a pretty low number, which is then speaking to that piece that somebody had asked about earlier, how do you go for some, how do you reflect some of those strengths and abilities, but then you're starting to recognize that somebody is not feeling that they can actually complete The miracle question is basically asking somebody if they were to go to bed tonight and to wake up in the morning, and whatever the desired behavior, whatever it is that people are on them about trying to change is gone. So I usually stick with substance abuse issues, or like say that they need to find a job or housing or something of that nature. So it's keeping them focused on what do you see when you wake up that lets you know that the situation has resolved itself or that it is no longer present. So it is not about the miracle, so that you do not want to have people sort of taking you on some sort of, story about lotto and, winning in large houses and things of that nature. It's really about you wake up in your home or wherever you are, and you somehow know that the situation is no longer present. And I've had people say, well, I knew because my mother was making me breakfast. I knew because my alarm clock went off and because I had to go to work. That is what you're looking for. So that, again, what you do with those responses is you build them into sort of your case plan of getting them to sort of move forward on whatever the goals are at that time. And then the survival question, as Tina was speaking about earlier, is that how have people been able to certainly, survive, maintain a job, maintain their housing, and so on and so forth in the face of, sort of adversity or different types of challenges and so forth. And I think that question also lets them see that they have tried to do things and what they have certainly tried to work on. And it also reflects that you note that they have made some sort of, attempts at doing things differently and so forth. And that it notes that you've noticed that they are, have had a lot of challenges and different types of concerns.
We've also had a question that asks, how long in general, this is from Melissa, how long in general does it take to complete a Genogram?
It can take any time from an hour, 10 minutes. It depends on your conversation with the person, because you can definitely make the outline, put ages, names, and accomplishments, strengths. Like I said, it from 10 minutes to an hour, you can have a Genogram done.
I think it depends on what what you're looking for, how long you have. A lot of the information, oftentimes, if you notice on a Genogram, is probably a lot of information that you already gather on a lot of individuals. And on the EcoMap as well, we're not talking about new information. Generally speaking, it's all information that you know about the individuals. It's about sort of how we present it in a different way that reflects. Again, if you think about sort of where we began with the family-focused approach, that reflects sort of that kind of approach.
And then we also have a question from Richard. His question is, I'm a probation officer in Daytona Beach, and the majority of my caseload is homeless, transit, or have no families living in Florida. What advice do you have for me? Right now I do an average of 5 to 8 violations a week.
I think, here is also like who are who are the people that they do go to, or who do they reach out to? Who do they talk to? It could be that they are talking to other, certainly homeless individuals. Sometimes I think it's about, where was one of the last places you took a shower? Where was one of the last places you got something to eat? I mean, I think what was interesting for us here on the Lower East Side as well, and Tina can talk about this as well, is that we have a shelter up the block from us, not too far, and many of those individuals have come in, and many of them just sort of walked in because we are in the middle of an urban setting, so people can just sort of walk in. But we would find out once, or certainly they came in and so forth, that they also had criminal justice involvement. But many of them, through talking with them and certainly finding out a little bit about their lives, although would initially say they had no family connections and they had nobody, we would slowly find out, well, there's this nice old lady that they had met in the community, and they go to her house once a week for dinner, or there was something else. So there was, so it's about sort of how that dialogue happens, and also that oftentimes people don't reveal all of that information out of concern of getting somebody else in trouble.
For the very first time, as you go along, And if you utilize the Genogram and the eco-map, you're going to get more other people, because the person is definitely going to start saying, wow, so-and-so actually gave me a coat. And because of that, I'm grateful. And whenever they need to do groceries, I'm there to help her or him. So there's always somebody. People may say, I don't have anybody. No one has no one. There's always someone. There's always that pastor from your church. There's always a neighbor. There's always someone you've known for 25 years that you say it's your cousin, but it's not your cousin. It doesn't have to be blood related.
And I think Tina's point about the eco map is so critical. I think the eco map, and I think how you present that, so that if you're just following up with the man from Daytona Beach, so the person in the middle circle would just be your individual under supervision, and then certainly asking them, and I think it has to be like a walk in a month of their life, or, walk me through a week of your life. A week is usually a good time frame. And so that, what do they do? And so that you start to fill in those circles and to see who those connections are. And so that if it does come up that there aren't that many, circles to fill in or that many connections, then that's also a piece to begin to talk to them about, to be able to complete supervision, and so that we don't have, so these violations, to avoid these kinds of violations, we need to fill in these circles more. And how do we begin to do that, And so then some of the questions sometimes are about who are some of the last people to cut you off, who were some of the last people that, that you were in contact with. And do you think that if we were to write them a letter, or we were to contact them in some way and tell them that you were willing to do some things differently, do you think they would respond differently? Mm-hmm. I think it's not, and as Tina said, I think it's about not letting people off the hook by saying, I have nobody. I think that oftentimes some of that also is about protecting families and social connections that the individual feels they have harmed, or in some way, and so they're like, well, I can't go back again, and I can't do these things. But I think it's about pushing them to start to look at that, and to also recognize that the chances that anybody will complete supervision successfully, completely on their own, with no network or any social supports, is pretty bleak. The majority of people, and the research, continues to sort of, show us that people who do well are people who have those social networks.
And then one final question before we move on. Where Lisa asks, where does the funding come from for the case managers that you mentioned earlier?
Department of Hygiene and Mental Health.
Well, we have some from the Department of Mental Health, but we also do a lot of partnership work with Probation and Parole.
Okay. You ready to move forward?
Yes.
And you guys can continue to ask questions by clicking on your chat button, and we will have one final opportunity for questions at the end of the presentation. Okay, Christine?
Okay, so the one other thing I wanted to talk a little bit about, which I sort of referred to at different points, is the idea of, supporting research and the research that exists at this point around our work. As we mentioned, La Bodega de la Familia is a direct service site from Family Justice, but La Bodega de la Familia began as a project of the Vera Institute of Justice, and that was sort of where we began, and sort of spun off from Vera and then became our own organization. But we were very fortunate from when we started to have Vera sort of study our work, and I think our first slide that I have under here is basically sort of giving you sort of the highlights of what we found, what Vera found when they came to sort of look at our program. And I think that one of the things that was so sort of gratifying about that sort of research and those findings were the idea of sort of the recidivism rates and the decretion that we had seen there. And that truly, and it's not necessarily highlighted here, but the fact is that this was not based upon using different kinds of programming in terms of drug treatment or counseling. This was not based upon giving more treatment necessarily. It was based upon certainly giving the same amount of drug treatment and the same amount of services that others in this community were receiving, but the difference was the engagement of family members in social networks, that they were included in the process. And with our parole, our families were engaged prior to release of the individual on parole. So the individual who was coming home to our particular community, which is a small community here in Manhattan on the Lower East Side, parole officers would not only sort of send contact letters to individuals who were about to be released, but on the community prep visits, talk to the families. And that whole discussion was about how to prepare and the idea that they would need to be part of the process for the individual to be able to stay home in the community. And so I think that, and that's pretty much where we began, was on the parole side, and that was the beginning of our work, and then moved on to also working with probation. So I think that was the piece that was most important, because people would be coming home from parole and their families would have already heard, had a different sort of dialogue about what their expectations were, about how. And I think the other thing too that we talk about in training isn't so much about sort of deputizing family members. It's about working in partnership with them, so that it wasn't seeing them, because I think, going back to what been hinted at in different ways, is that we have to recognize that oftentimes there is a distrust between families and community corrections officers. So it's so much about the approach of saying we're coming in to work in partnership so that your loved one can stay safe and stay within the community, versus I'm coming in and sort of deputizing you and hoping that you will find out or let me know when there's something wrong going on. So there's a certain different kind of dialogue that needs to happen there as well. Besides this,
Christine?
Yes.
Can I interrupt? We did have one question come in while you were on this slide that's pretty much specific to this slide, so I thought I would go ahead and insert this question here.
Sure.
Okay, with you. And it's from Richard, and he asks, what was the decrease in your recidivism rate, and do you have any studies longer than 6 months?
To tell Richard I don't know the recidivism rate decrease off the top of my head quite like that, but from our website, which you can get at the end, you can get the full VERA study. You can access the entire VERA study, which would tell you the exact number on that, and I am sorry, I don't remember it. And we have done, we've been doing a lot of further studies, and we've been doing a lot of work with other jurisdictions that have taken on our work. We've done some work in New Jersey and sort of looked at that over a longer range, and to see sort of what's happened there with other types of not only sort of community supervision agents, but also some nonprofit organizations that have also taken on our model and certainly worked with it in different ways. So there's certainly a lot of research that are coming out as well, or longer term than that. Okay, the next slide. I think the other thing to keep in mind is that we, certainly beyond our work and the research that's out there, we constantly are seeing, and the Urban Institute has done some really interesting work, and again, certainly the VERA Institute of Justice, but the idea that we see more and more, certainly, how support and acceptance from families result in greater success, and how they can help reduce recidivism. And so we see that, and I think when we naturally see that occurring, it goes back to what somebody had asked the question about earlier. Well, what do we do about those families that are resistant? And I think that we need to sort of change the way we ask that kind of question. I think, one, we have to kind of assume that all families are going to come in guarded around being involved in the community supervision process, and that I think the reason, I think we need to understand that as being guarded and being concerned, and I think we have to understand it in context that many families have been burnt by different systems that were set up to help them in different ways. And so that how do we begin to engage in a dialogue? And I think part of it is helped by understanding, engaging families around a partnership instead of sort of instead of thinking them as deputizing them, or that they are somehow going to be caught too, or they are somehow going to be in trouble. And so I think that has a lot to do with how we begin to think about engaging families and social support differently. And I think that, we can't ignore certainly the research that says that what an important piece this is. And then I think that what we're looking at and what we've really been able to work with is the idea that many in these tools, and as Tina spoke about them and what happens to families when they are engaged through these tools, is that you begin to see families responding in a different way than they usually do to community supervision agents. Do we have another? Oh, we have a question. Any more questions? I thought we had another polling question, but I got confused, I guess.
Oh.
No, that's okay.
Okay. No. We do have several questions that have come in, and we've got maybe 10 minutes or so left to take questions. Well, let's see. The next question that came in was from Shanna, and she asks, what do you suggest for family members who are the enablers of the parolee, i.e. mothers who cover drug use, criminal activity, family members who deny violations, and whose only interest is the person staying out of jail, not actually becoming successful. And then she goes on to say, and by only interest is in staying out of jail, she means those who just want us to release the subject from jail once he or she is placed there as a violation sanction.
Well, I think that you have to look at, I think that goes back to sort of, how we understand sort of some of the dynamics that are going on, right? So that here, in many situations, the family member just wants the individual in the community under any circumstances, whether they're using, not using, that's not, that's fine with them. And I think that we need to look at, one, what does the individual want? Talking to the individual about how does certainly staying in the community and using get you closer to whatever your goals are. So I think that that's a piece of it. I think also we have to, recognize that these family patterns are very strong. And so that is why if we sort of ignore them or don't sort of pay attention to them, they keep coming back, right? So that we oftentimes talk about enabling behaviors and things of that nature, but what if that parent or that individual was also engaged in the discussion? What if they are also struggling with substance abuse? What if that is one of the reasons for wanting to keep the other, family member also using? What if that discussion was changed, that the two of them were able to go for treatment? So I think, there's a lot of ways of sort of looking at that.
What if there was children involved and grandma's too old to take care of children? And they want them to take on the responsibility, so they want them to get treatment rather than to be incarcerated and can't help out at all. So a lot of families struggle with this. It's not only about the individual, it's about the individual and their loved ones. So we look at everything in whole so that we can kind of find how do we get this person into treatment, get them better, so they can come back home and take care of their kids, and it doesn't have to be a burden on grandma or auntie or Uncle John.
Okay. Next question is from Richard, and he asks, how do these instruments control for the family members who retain antisocial attitudes, values, and beliefs that may fuel criminal behavior and recidivism?
I'm sorry, Tracy, could you just read the beginning again? How
do these instruments control for the family members who retain antisocial attitudes, values, and beliefs that may fuel criminal behavior and recidivism?
These tools don't control for that necessarily. What these tools do is they give us an understanding of what is, so to speak, so that prefer to hear up front, right, in terms of looking at the Genogram or the eco-map or asking some of these supportive inquiry questions. I want to hear what their perception of the situation is, what they're seeing, right? And through that process, start to recognize if there is antisocial thinking or other concerns such as that going on. But the tools themselves are about really getting the voice of the individual and the family out. Once that's there, then certainly your case planning and so forth can begin to happen from there. And so that, again, I think it always goes back to the fact of this is who you've named as your social support people. These are your goals. How do they go together, or how do they not go together? And if they don't go together, then how does the individual begin to build a new social support network? And I think that, you need to at least first see what is before we start to
say what should.
Right, to say what should be, exactly. And I think the other important piece, too, is that oftentimes what we're seeing as antisocial thinking patterns and so forth is very much sort of normative to them, and so that we need to be careful how we begin to address that.
The next question is from Daleen, and her question is, was family participation required in order to be part of the program? And I'm wondering if maybe she's referring to the recidivist study or the VERA study.
Well, the thing is that we don't require people to come through the door with their family because, again, if people came to our door the very first time with their family, we tend to feel like, well, they're already in a fairly decent place, right? They've recognized they need their social network, their social supports, and they've got them with them. But we do, generally, our referrals come as individuals from probation, parole. I just got this person, I just got this. That's how they usually begin. And then we talk to them about the importance of having their social network or their social connections involved in the process, and talk to them about why that's important, and then work with them to identify who those people are and then begin to meet with those people.
Okay. Next question is from Ellen, and her question is her comment is asking you to describe specific behaviors, anecdotal, of probation officers which helped.
Behaviors that officers have? Well, I think that, I think that a lot of, the important behaviors to begin with for officers are, I always, and in the longer training we talk about active listening techniques, and I think that those are very important. I think, our body language says a lot. I think open-ended questions are crucial. I think that you need to be able to give people, and that's, I think, what the tools are about in terms of thinking, if you think about them in this way. It's about hearing what they have to say first. And I think that is very difficult. I think in the abstract, no, that is not difficult. But I always like to say, well, what if it's the, 11th person reporting today? Can we still maintain a neutral stance, open-ended questions, allow them to sort of, set some of the tone and to sort of then begin to reflect back to them what you're hearing. Because I think that so much of this has to do with, one, this is their situation. They're under supervision. They need to figure out who they need to activate within their social network and be able to, sort of tap into that social network to be able to come out of supervision successfully. Us telling them what they need to do and what needs to happen generally does not work all that well.
And I think this question probably is similar. Framing it this way, you'd have any other things you'd want to contribute. But it says, this is from Stacy, and the question is, what specific activities did you conduct amongst the families to promote dialogue and support?
Well, I think one of the things that we do in terms of, specific activities is that we have, one, we've really worked with if we do see the individual and their family. And it's not that we're also saying that, obviously, supervision agents have a hard time being able to see individuals and their families, but are we asking questions about their families? Are we asking relational questions of them? If we're meeting with both of them, do we really try to have them speak to one another instead of of speaking through us. I think that's something we do a lot of, is like, you need to say this to so-and-so. I also think that we talk to families about, what they can do. I think oftentimes families worry, and I like to use the example of somebody's under supervision, and so they identify their support person as their mother, let's say, and they come in. Or you meet with the mother, and she, and he says, all she does is get on my back about not getting a job, like constantly. And I'm telling her I'm looking, but she keeps yelling at me, and we get into a fight every day, and so on and so forth. And so you ask the mother, do you know anybody who's currently, employed, or anybody who has a job or who's enjoying their work, and so on and so forth? And she's like, well, my sister, she works at the hospital. And so you say, have you asked your sister if she's looked at the board at the hospital to see if there's any job openings or anything that might be good, for her nephew, for your son? And she's like, oh. And so this gives her, like, something to do with her worry as well. It activates her. She wants her son to be successful. She knows that employment is a piece of his supervision mandate. She knows that if he does that chances go up that he won't be recidivist, and so on and so forth. So it's also about helping families recognize what they can do. And so often the worry and sort of the arguing and other things that tend to happen is because they don't know what to do with sort of that energy, or what they could be doing to sort of assist in the process.
And then another question from Lisa is supportive inquiry the same as motivational interviewing?
No, it is not the same. Motivational interviewing is in and of itself quite a process in terms of training and so forth, and it takes quite a skill set. What we do though, is that, from motivational interviewing, there's always, a large section around active listening and how that's really important, and certainly we stress that. We also do stress, which also comes out of a strength-based perspective, not just motivational interviewing, the idea of the person maintaining some control, and sort of always, sort of giving back certainly the power and the control to them, so that it's like, well, what are you going to do about this? Sort of reflecting back to them, or what are you and how are you and, your social network going to figure this out, and so on and so forth, really believing in their expertise in their lives. And the other questions, the solution-focused questions, really come out of solution-focused sort of, counseling techniques. But certainly there are certain, elements and departments, when we did, as I mentioned at the beginning, that APPA and Family Justice pilot this curriculum in 4 different sites around the country. And certainly the departments that have had training around motivational interviewing prior to us coming in really felt that this was a sort of natural match, and it was certainly something just to sort of enhance the skill set that they already had. But motivational interviewing can, but doesn't in and of itself address the family component.
Okay, I believe that's all the questions that have come in, and we're getting close to the end of the broadcast. So, Christina and Tina, do you have any final comments that you want to leave participants with before I close out the session?
No, I hope that people found this helpful. I think that, obviously it was a short amount of time to go through, a bunch of information. The one thing I will always say is that I always recommend that people certainly try the tools. I always recommend that people try them with people that they probably feel they have a good rapport with already, because I think that will demonstrate to you how they work, and then it certainly gives you the motivation to continue. You'll see on the slide in front of you now, you have both Tina, myself, Christine Toner, and Tracy Mullins' email addresses, and I would encourage you to please email us with any questions or any other thoughts that you might have after the conference.
And if anyone's not comfortable to do it with a client, a client at this point, you can do the tools on yourself and your family, and kind of get an idea of how to kind of work it and utilize it with your clients.
Good point.
Okay.
Thank you, Tracy. Thanks.
Well, I want to thank Christine and Tina for providing us with information today on what community supervision officers need to consider when they want to implement practices that are consistent with the family support approach for community corrections. I also want to thank all of you who participated in today's broadcast. You had great questions, and it generated some really good dialogue. So I hope that the session has given you something to think about, as well as provided you with some information that you need to be successful in your efforts at engaging families and social networks and supervision practices. If you would like to view this broadcast again or let some of your colleagues know about it, this broadcast has been recorded and it will be posted on the Apple website within the next few weeks. We will send an email to everyone who registered for today's presentation to alert you when it's posted. I also want to let you know that APPA and Family Justice are working on a guiding principles document that will provide a written way of presenting some of the information that you received today on how community corrections officers can go about implementing these approaches as well. So be on the lookout for that. It'll probably be available, hopefully at least online sometime later in this summer. If you would like to learn more about the family support for community corrections, you can contact APPA or Family Justice. Our email addresses are on the screen right now and in your handout that has the slides from today's presentation. You can also go to Family Justice's website at www.familyjustice.org or to the American Probation and Parole Association's website at www.appa-net.org. In conclusion, we respectfully ask that you take a few moments after the broadcast ends to complete the evaluation form. There is a copy of the form on the APPA website with the other handouts for this session. If you use that form, please complete it and mail or fax it back to us. Our contact information is included there on the form itself. If you prefer to submit your evaluation online, we will be emailing a link to all registered participants after today's broadcast where you can complete and submit an online evaluation form. Your feedback is vital to helping us plan and conduct future events like this one, so I thank you in advance for your assistance. Again, thank you, Tina and Christine. We really appreciate it, and this now concludes today's presentation. Thank you and have a good afternoon.